Hi guys, welcome to this episode of Responding to Your Questions. My name is Dr. Sylvia. I'm a consultant in general practice, and in this segment we look at questions that you've sent me through the comments section of one of my videos. Today we're considering genital warts clearance. So let's have a look at the question. So this says, Doctor, I've seen many contradictory information about HPV infections being able to get cleared or not. Some say that most people will eliminate the virus without ever knowing they had it, and some say when it stays, it causes genital warts and other symptoms. Does that mean you can only get cleared if your body didn't let it grow, or you can be cured even after clearing the warts? Okay, so I know there's a lot of confusion around genital warts. Let's just make a few statements about it, and this really should address the questions here. The first thing is that any genital warts are benign and usually they are asymptomatic. So it is possible for somebody to have the HPV, which is the human papillomavirus, which leads to any genital warts, and do not show any symptoms. They do not develop the warts. The other thing is that if an individual does develop the warts, what can happen? Now, without treatment, it is possible for the warts to completely settle. In fact, in a third of people, within 3 months, the warts actually settle by themselves without treatment. In another third of people, within 6 months, the warts would have disappeared without any treatment. But of course, it's difficult and it can be challenging to sort of sit and wait for the warts to disappear without doing anything. So in response to this individual's question, they may have an infection with HPV, not show any warts, and then eventually be cleared of the virus. And the last thing to say is that most times infection with HPV is temporary. So it is possible for the body to clear it after some time. And in fact, 95% of people who were previously infected with HPV show no sign or detectable level of the virus by 2 years of that infection. So I think this addresses the question. It is true that some people can contract the infection and within some time, and that can vary, clear the virus from their system. In some people, it is asymptomatic. In others, it is not. If it's left untreated, in some people, it might disappear within 3 to 6 months. In the majority of people, by 2 years after the infection, there is very little trace of HPV. Let me know what you think. If you have any other questions around HPV, don't forget you can use our email health information service. And if you want one of your questions to be featured in this response to your question segment, send it in the comment section below. You might be lucky.